We're a community-based trust, so we operate in all locations across the county and beyond, providing services wherever the patient needs them and delivering to all ages and with a variety of health conditions and care needs.
When I came out as gay in year 10, so last year, I found quite a bit of struggle with school, things like bullying, some family issues were in there. Didn't want to go home, I didn't want to go to school, I didn't really want to speak to anybody, I just felt isolated, and I put myself in the isolation as well as other people not accepting. I first seen a school nurse at my previous school, then she referred me to CAMHS and a dietitian at the same time. CAMHS were very warming and welcoming. Felt like they was going to help me no matter what, and I think they made sure I was their first priority. We had a lot of counselling sessions. Sometimes in my school, there was a few at my house. I did a few in CAMHS base to just talk about, it could be anything, any issues I've had or what my counsellor had to say, any advice. She said, learn to breathe, learn to think you are still human, that these people's opinions, if they're horrible, they don't matter. Now, after CAMHS and, through the sessions, I feel I've been helped a lot. I can stand my ground, tell people that sometimes what they say is politically incorrect and hurtful, and I can be more assertive, but in a good way, and not be too overpowering, as well as listen to other people's opinions.
The values are very important to me, and what that means for me on a day-to-day basis is to ensure that we've got open communication, we're transparent in the decisions that we take, and that we use patient care as our guiding principle.
When he was 2, he went for a 2-year check, and he wasn't doing what he was meant to be doing. So he wasn't putting a couple of words together, he wasn't sort of communicating, there was no eye contact. Basically we went to the Child Development Centre at the hospital, and they did a series of tests over 2 mornings, and then they just turned around and said, he's autistic, he's got all the traits of being on the spectrum disorder. It can be quite heavy going because he doesn't communicate, because he's got sort of no imagination, and he doesn't understand if sort of safety aspects, things like that. So we sort of permanently keep an eye on him. It's like having a toddler, but now he's 13, it's still like having a toddler, so you're sort of always watching out for him. So it's quite hard, and it's hard on my other son as well. So we went through the local GP, and I said that we're really having trouble getting him to go for a poo on the toilet, because he'd been weeing on the toilet from about the age of 8, and once he got the hang of it, he was fine. But we were still having real problems. So then that's where the incontinence service got involved. They've just sent someone out to help us to sort of just evaluate things, really, because obviously some kids don't like the toilet or the bathroom, or they don't like the plop of the poo, things like that. So we've had different people sort of come out and help us. So it's been really helpful.
Go.
when you live with autism, you can't sort of always see the wood for the trees. So it's nice to actually get someone in to say, have you tried this? And, you know, perhaps persevere with this and try this. So, yeah, it definitely helped. But it's important to know that they're sort of there to support him as well, because it's not just for us, it's for him, because, you know, although he is autistic, he's still got to sort of grow and he's still got to sort of grow up. So it's obviously for him, it's the main thing that we got it sorted, so yeah.
Patients and carers can expect many things from us. We want them to be very sighted on the transformation we have prioritised. We want them to feel that holistic care and integrated care is what we're about to achieve, and I want them to actually actively work with us to embed that and to help design those new pathways of care with us. That's what I want them to achieve with us.
This is a department of spiritual well-being. The service we offer is for people of all faiths or people of no faith at all. Everybody has a spiritual need, everybody has a spiritual part of their being, and we seek to meet that need. So it could be patients, it could be staff, it could be carers. Sometimes people just need a listening ear, somebody to listen to them, to take them seriously. Sometimes they just want to talk about their problems that perhaps they don't want other people to know about. It may be grief-related issues, or it may be that they just don't understand why these things are happening to them. So it's sort of a personal journey of discovery. At Berrywood we have an interfaith chapel, but it's a very special space. It's quite intimate, it's got some beautiful colours, especially when the sun is shining, and it's a very peaceful and quiet space. It's open 24 hours a day. People can pop in, and they frequently do, sometimes to say prayers, sometimes just to sit quietly, sometimes to come and have a chat. There is also a chaplain's office, which is also a very comfortable space, a safe space, very confidential. We also have this garden, which is a quiet garden. It has some activities, but most of the time it's just for people to come and sit and just feel comfortable about themselves. There is no typical day. Every day is different, which is one of the great joys of the job that I'm in. I never know what's going to happen. Sometimes I spend all day on the wards here at Berrywood. Other times I will visit patients, community patients. People will pop into the office. I just don't know what's going to happen. We can try to fix them physically, but if they're spiritually lost, then the journey's going nowhere. So to help people on their spiritual journey is one of the greatest privileges, and I just love my job.
There are a lot of people that come into prison that have got problems with drug use. So what we're trying to do is to break the chain. We provide a prescribing service in 2 prisons, that's HMP Onley and HMP Rye Hill, for people that have problems with drug abuse.
I came from another prison to this prison, in which I was using heroin and crack cocaine. When I entered the prison, I was put onto the methadone program. After about 2-3 months, I reduced down to nothing, and just thought, it's a good time to try and sort my life out and address my issues, which obviously were my drugs use. I wanted to do some sort of peer mentoring, and then I came to this prison, and I was given the chance by a lady called Teresa McGettigan, and she gave me the opportunity to get trained up and work within the healthcare, which I've been doing now for the past 18 months.
We help facilitate mutual aid and mutual aid groups such as Narcotics Anonymous, Alcoholics Anonymous, SMART, but we also developed our own programme which the prisoners named. So we had First Steps and then New Horizons, and First Steps then would look at how they're going to prepare to come off their medication, and then New Horizons then was about coping strategies to actually continue that, and that is now facilitated by really, I suppose, ex-users within the establishment.
I engage with other prisoners who want to change their lifestyle with regards to maybe they want to maybe stop smoking or lose weight or stop using alcohol, drugs, or just doing more exercise, just health improvement, lifestyle changes.
A lot of the time, health professionals and drug workers, although we know what to do and what to say and how to try and motivate people, to the great extent we haven't been there. And I think somebody that's been there, done that and been through it has got a greater message to give than health professionals at times.
If I'm going to sit there and talk to another user or someone who's had substance issues about substance issues and start quoting from a book, that person that I'm talking to is going to know very soon on that I've had no real life experience, and if I was that person I'd switch off.
Rather than being seen as a nobody and as a drug addict, to somebody actually that's got something to put something back into society and to start breaking this chain. And I think Andy has said that eventually he would like to use skills that he had previously, like football and stuff like that, to actually then work with youngsters and to prevent them actually starting to use drugs then, which will hopefully prevent them coming into prison.
I've been using one drug or another for the past 30 years. I've missed loads of opportunities in that time. I've got a daughter out there, she's 10 now. It's just knowing that I'm better than what I've allowed myself to be, and having time to reflect on it and get a clear head and move on and get on with my life basically. And I'm not getting any younger. It's just wanting to realise my potential, really. And I know I've got loads to offer. It's just getting the right opportunities and getting on with it, basically.
I'm really proud of many things, but in particular I'm very proud of how the staff have shown their continued commitment and hard work, adapting and absolutely responding to the challenging climate that we're in, innovating and delivering new ways of working.